Okay, in this video, I would like to talk about the paracetamol overdosage. When I was an RMO in Royal Hobart Hospital, this was in around 2009, I saw my first case of paracetamol overdose. It was a bit scary for me because it was a 11-year-old girl who actually took 28 or 30 paracetamol tablets with an intent to kill herself because she had some argument with the elder sibling. So this is a very common scenario in the OSCE, and paracetamol is something that is easily available, like lollipops in Australia, probably US, India, anywhere it's available. So the key features in history are you need to know the timing and quantity. So how many tablets did they ingest, what time, because it is very very important about the time since ingestion and also the ingested dose. This is the weight you need to follow. Then the intent, is it accidental, or suicidal attempt? Then look for symptoms. Are they having any nausea, vomiting? This girl had tummy pain. So she had a lot of pain. So she was very uncomfortable. And sometimes in severe cases, like where people take hundreds of them, they will probably land up in coma as well. So make sure you ask for liver disease and alcohol, because alcohol is a hepatotoxin. So you need to ask about that. Again, you need to ask about other medications that can cause hepatotoxicity. Then key examination findings. Usually in the first 24 hours, there's nothing. So this is what you need to ask in the history when you're in the OSCE scenario or in your real life. You need to ask, what is the timing, what is the quantity, where am I now? And usually there will be nothing in the first 24 hours, but later stages. So you need to monitor this patient. That is the key here. So when they say the patient was brought in with paracetamol overdose by the mother, and it is 6 hours since ingestion, and you find everything will be normal. So you need to observe this child. This is a very tricky case and a serious case. So make sure you document all these findings. Looking for right upper quadrant tenderness, hepatomegaly, jaundice. These are other signs of liver disease, signs of liver failure, absence of other findings. Then the key differentials are viral hepatitis, alcoholic liver disease, autoimmune hepatitis, drug induced liver injury, biliary disease, sepsis, because all these will present with more or less similar symptoms. So you need to rule out these differentials in the history. So history is very, very important. Then there are some mnemonics you can remember. So NAC as the antidote for paracetamol toxicity, N-acetylcysteine, then Rumac Matthew nomogram. So Rum tells us when to mat the antidote. Sorry, serum potassium levels spotted against hours since ingestion to determine need for N-acetylcysteine. So that's the N-acetylcysteine is the pharmacological antidote we give to this patient. Then you look for serum levels as well. Then key features mnemonic is liver, level of ingestion, and the dose. Initial symptoms, nausea, vomiting, we read about them here. Then any LFTs, like any derangement of liver function tests, any effects of toxicity or damage, and repeat and monitor the LFTs. This girl had to go through crazy blood tests when I was thinking, when I was treating this patient, and it was a pediatric registrar who was treating her, but I was relatively new that time, so it was all exciting for me. I was very excited to see all this because I've never seen this back home in India as a intern. So that's how it all started ideally within 8 hours of ingestion. Then if it's oral, if it's 72-hour protocol and 21-hour protocol, you need to give her fluids, correct any coagulopathy, any hypoglycemia. If they go into coma, as you can see, if they take too much ingestion, then they go into coma. So you need to think about mechanical ventilation, serial LFTs, and also serum acetaminophen, which is paracetamol levels. Then main investigations to rule out differentials and to confirm diagnosis is serum paracetamol or acetaminophen, which is the drug name of paracetamol, peak at 4 hours post ingestion, Rumac Matthew nomogram to assess the toxicity risk, This is something I was not sure that time, but the pediatric registrar was following this carefully. Then imaging, abdominal ultrasound. Again, you need to rule out other differentials. Okay, so blood test, serum salicylates to see if there's any other poisoning involved, because this is another thing that's readily available. Then paracetamol level, serum acetaminophen level, blood glucose, liver function test, mainly looking at ALT, AST, bilirubin, and INR. So I hope this is helpful. If it's a case in the OSCE, make sure you ask all these key things. This is very, very important. So I hope this video is helpful, and I will see you in the next one.